Dr. Patel here. Happy Friday. Happy early Thanksgiving to everybody here. Hope you are all doing well. We have a great topic today to discuss. We're going to be talking about tendon injuries and the different treatments that are available for those tendon injuries. Really happy today to have two wonderful guests with us. Wondering if you know who those people are behind me. Basically, I have my medical student Rocky over here.
Hello, everybody. I want to thank Dr. Patel for having me on his live. I appreciate it.
Absolutely, absolutely. And then we have exercise physiologist Alan here.
Hi, everybody. Alan. Thank you, everybody, for having me here today. We'll talk a little bit about, tendon injuries. It'll be great.
That's right. That's right. So, first and foremost, just because we have a lot of different people that come and watch these, wanted to make sure that we're kind of all on the same page as to what tendons are and what kind of injuries can happen with tendons. And then I'm going to go into these two guys because I want to make sure that I highlight some of the knowledge and experiences that they have. So first of all, what is a tendon? A tendon is what attaches muscle to bone. Think of it as the rope that actually pulls your joint when you're moving. So one of the most common tendons that we're going to be discussing today is the Achilles tendon of the ankle and foot. That's the tendon that connects with your calf muscle. That's what's in charge of making us do tiptoe raises and things along those lines. So what kind of tendon injuries can occur? There's a few different categories of injuries. One most common injury that people hear of or think of are when the tendon gets torn. A tendon tear could be partial thickness, meaning a part of that tendon is torn, or a tendon tear could be a full thickness or even a rupture, like the whole tendon has disrupted entirely. Minor injuries include things like what's called tendinopathy or tendinosis, which is irritation to the tendon fibers. So what happens is if we're moving funny, if our muscles aren't firing properly, if we're not moving correctly, the tendon fibers can get disorganized and irritated, and that in itself can cause pain. But the good news is that there's a lot of things that we can do to treat that. The bad news is if we have that tendinopathy and those tendon fibers are irritated, and if we continue to not move properly, or if we have an injury, those tendon fibers that are not moving properly can get torn, and that becomes a more serious issue. So I wanted to talk to Rocky specifically because he has a history of a tendon injury with his Achilles. So Rocky, tell us your story.
Yeah, so as Dr. Patel just mentioned, tendinopathy, when the tendon tears. So I had an Achilles tendinopathy at the age of 19, which is actually pretty young for an Achilles tear. It was an insertional tear, which is essentially at the insertion of the tendon into the bone. And I was playing basketball. I had just come down from a fadeaway, and I felt like I got kicked in my calf, and I just dropped to my butt. And so my brother was with me, and he dragged me to the side, and he's actually a physician, so he knew. He's 6 years older than me, and so he knew what had happened. And so he told me, he's like, "Bro, you just tore your Achilles." So it's a relatively common injury amongst people who play basketball and volleyball especially, and it was an arduous process coming back from it. The rehab process was really tough. It took about 9 months, but I had a surgery before that because my whole tendon had actually come all the way up into my calf. It had essentially recoiled up into my calf. So I really had to learn how to walk again, and it's one of those. The Achilles tendon is the biggest tendon in the body, so it was a tough rehab process. I was afforded the opportunity to have some Shockwave Therapy recently, and that was excellent. That really helped out.
We'll talk about that, but I want to hear a little bit more about the injury itself and what led you to have the surgery. Because for those of you that are joining us and know, most patients come to me to try to avoid surgery. But if you've heard any of my things before, sometimes surgery is absolutely necessary. So that being said, this sounds like a necessary surgery to me, but tell me the thought process behind it and tell me what happened with the surgery itself.
Well, like I said, the actual tendon just completely snapped and came back. And I know that there are therapies which you are much bigger expert in, that you don't need surgery and you can use those modalities. But the rehab physician actually looked at it and he said that you are going to need surgery. There's going to have to be reattachment there. And so, me being 19, I had no idea. I said, I just tore my Achilles, I need surgery, right? So that's where that went, yeah.
So he had a good point. There's some situations where surgery can be avoided, and there's some situations where surgery is absolutely necessary, right? So what Rocky's describing here is, if you can picture the tendon fibers together, right? Sometimes a partial thickness tear can occur where some of those fibers get torn off, but there's still some fibers that are attached. When there's a partial thickness tear, sometimes that could even require surgery, but oftentimes we're able to help that kind of tendon injury with things like regenerative medicine, PRP, stem cell type stuff, with appropriate exercise. And Rocky mentioned shockwave therapy. That's something that could be helpful for partial thickness tears as well. And I'll let Alan talk a little bit more about that in a minute. But when those fibers are completely disrupted, and if with a tendon like the Achilles, when that disruption occurs, it's not like that tendon is still going to be sitting there. That tendon is going to roll up into the calf because of the way that tendon structure is. So there's nothing we can do conservatively to bring those tendon fibers together. That needs surgery. But given the fact that we walk, I don't know anybody that doesn't, but we all walk with 2 feet, right? So we're going to have to be using that leg with every step that we take. So the recovery process is pretty long and intensive. Tell me more about the rehab.
Yeah, and I was going to go off that. So the surgery, of course, is important, but I think the rehab is more important for the longevity of your life, because for me, it was on my left leg, and I have had extreme compensation in my right leg. And I've noticed that throughout the years. And if you have the appropriate rehab and you're using as many modalities as you can in the right, let's say cocktail, it really can prevent long-term injuries from occurring in the other leg. For example, Klay Thompson, he's a basketball player. He recently had an ACL tear, and then he has been compensating on his opposite leg and just tore his Achilles. So, that compensation is just the body's natural response. And so if you're using the appropriate rehab techniques, stuff that Dr. Patel does especially, and shockwave therapy, if you can use the right combination, I think you have a really good chance of sort of having a better longevity of life and of those tendons. So
I think that's a great point. It really comes down to is, with any situation, not just tendon tears that require surgery, but really any situation, not one single treatment is oftentimes the cure. We have to hit things from multiple angles. If it's as simple as a surgery with the right physical therapy, we can't neglect things like nutrition, making sure that our body has the ability to heal for situations like that, right? Using the right biologics to augment a surgery, or to replace a surgery in certain situations. And you use the word modalities. So modalities are types of things that could be done to you to help along with either your pain or the healing process. Simple modalities that most people use and don't even think about as modalities are things like ice and heat, right? Ice can decrease inflammation and improve pain. Heat can actually help with inflammation and decrease pain. But these are modalities that people use all the time that could be beneficial for pain symptoms, but also help with some of the biology of the area. That being said, one modality that I think is actually underutilized right now, is something called shockwave therapy. Now, this is actually something that has had a ton of research for everything from tendon injuries to plantar fascia injuries, or pain on the bottom of the foot. Unfortunately, insurance stopped covering shockwave therapy like a decade ago, and because of that, that therapy has pretty much disappeared off of the face of the planet, well, at least in the US. But we're lucky enough to have a great exercise physiologist here. I want to hear more about shockwave therapy, but before we even get to that, Alan, if you could tell us a little bit more about yourself.
About myself. Hello, everyone. My name is Alan. I have a degree in exercise physiologist, kinesiology, that specialize in sports medicine, which always been my most favorite thing to do. My dream was always to be the guy who ran in the middle of the football field to test the knees to see what happens with them. I always used to guess the injury before the trainer even went out there into the middle of the field. That was one of my things to do as an athletic trainer. That's where I wanted to go. But then I found myself being more drawn to physical therapy and helping people, helping them get back to the normal time of living, normal daily living activities in a shorter time period. So I have about 20 years experience in physical therapy, everywhere from, stroke patients to, paraplegics. As early I was talking to another doctor about it. But mostly the last 15 years, it's all been, sports injuries, knees, Achilles tendons, shoulders, jumper's knee, and all of that. So, and then I came across the shock therapy, and I found it to be very useful towards pretty much all the stuff that I just spoke about. It's just been helping out a lot. And I've seen a lot of results, and I'm here with Dr. Patel and kind of joining forces and helping out everybody to get better.
So tell us more a little bit about shockwave therapy. I mean, tell us about what it is. Well, first of all, what's the full name of it? And you guys can kind of chime in. We were talking about this earlier, but it sounds scary. Tell me more about it.
Yeah. Every time I say shock, somebody's like, "Oh my God, they're gonna put some plugs on me and like turn on the light or something." But in that, it's not anything like that. Shockwave therapy, it's more about creating a sound wave that goes down deep into your tissue, breaks down tissues at a cellular level, which increases the blood flow into the cellular level and starts helping, rejuvenates, and heals the tissue from within to the outside rather than do something more of a superficial thing to help it out. So it's helped out a lot. Shockwave therapy came across, they were talking about World War II and all that, but the most recent stuff was when they were doing shockwave therapy to break down kidney stones. Mm-hmm. So as they were doing that, as they were trying to do that, they found that patients were actually not complaining about their back pains anymore. So they started comparing what was done in between.
That's interesting.
So when they found out, it's like, okay, these waves that are going into the kidney was also spreading down to the spine or the lower back, all the muscle tissues, tendons. And when they did MRIs or CT scans, they found differences in.
Oh, that's interesting.
Yeah. So they found the differences and all that, and they're like, hey, why don't we create a machine that does just that frequency, and it just kind of helps in that scenario.
That's really interesting. So sound, right? So it's the energy that comes with sound that's used in different ways.
Yes.
Originally used to break down rocks in your kidneys, essentially.
Yes.
Right? But in order to get to those kidney stones, it was passing through the muscles, the stuff, and that's really, really fascinating. So I learned something new today. That's really cool.
I have the head of the machine that we call the gun.
Yeah.
Which kind of show you what it is. It's really not that. Looks something just like that. It's really cool. It's got a small little pin inside. This end attaches to a compressor.
Okay.
And the compressor shoots the pin back and forth, hitting this brass head right here, which is applied to your skin that way with some ultrasound gel on it. And it just keeps hitting it, creates sound, and there you have it. It starts breaking down the tissue as much as you can.
And this is a different modality than the ultrasound that I use to actually visualize things inside your body. This is a different modality than different types of ultrasound devices that could be used for heat, right? This isn't necessarily causing any heat per se, but it's causing a shock wave to actually go down and change the tissue architecture. So for a situation like an Achilles tendon, if somebody has a chronic tendinopathy or a chronic injury in the tendon, how is it that this works?
this machine with the chronic tendinopathy, it gets in there and breaks down the tissue that's inside, which gives it a little bit more elasticity. Because that's pretty much, correct me if I'm wrong, that's what it is with the tendinopathy, is lack of use, or when it's hurting and you don't use it, the fibers aren't as easily gliding with each other anymore.
Yeah.
Whereas when I come in with this, when we come in with this shock therapy, when we hit it, it kind of like breaks it down and let it heal. And meanwhile, you have to be moving it. You have to be active about it, and do a lot of stretching, a lot of the exercises that you're given, and maybe even some massage therapy to work on the muscles around it so they don't stiffen up all over again.
Yeah, if I may.
Yeah, please.
There was yesterday. We just did a shockwave therapy on my Achilles, and so it's been, obviously I'm 27 now, and it was 19. I was 19 when it happened, so it's a chronic issue, and just after one treatment, I could feel a massive difference. And there was actually a research article that Dr. Patel shared with me, and a major prognostic factor is that feeling after the first shockwave therapy, how it really feels after that first therapy. And that's a good prognostic factor for longevity's sake. And I think one of the things that really has to be added to shockwave therapy for it to really get to that 80% of success is eccentric loading, which maybe you can talk about.
Yeah, so eccentric loading is a type of exercise. Alan kind of hinted at the fact that doing the shockwave therapy alone isn't enough. We got to get the body moving correctly. So what happens when we have a tendon injury? Let me just take a step back. When we have a tendon injury, and these guys have heard me say this, if you're one of my patients and you've heard me say this as well, the tendon fibers are like the bristles of a paintbrush. So if you could picture that, all those bristles being lined up in a row, all parallel with each other, that's what a nice healthy tendon looks like. So a nice healthy tendon, when you're contracting your muscles, all those bristles are moving in sync. But when we have an injury, right, if we had a tear, or if we had a surgery, or if we are just walking funky and we developed tendinopathy, what happens is that those fibers start to get disorganized. They start to go in different directions. So imagine, visualize, take a paintbrush, dip it into paint, and leave it overnight, right? What does that look like? It's all kind of matted and crusted, and kind of, the bristles are all clumped together. That's called tendinopathy. And in a post-surgery state, some of those fibers are going to be stuck like that. And there's going to be some scar tissue that builds in that area. And that's what prevents that tendon from being 100% the way that it was prior to any injury altogether. So there's 3 ways that we can actually get those fibers working positively. And really, a combination of those 3 ways can be the most beneficial. So if you have those clumped fibers in different directions, one of the most common and least invasive things that we can do in order to improve that tendinopathy is the appropriate exercise. So when I say exercise, I don't mean just contracting your muscle and doing a specific exercise for that one region. We first have to take a step back and look at the way the body is moving and make sure the body is moving correctly as a whole. So for an Achilles injury, we may need to address the muscles around the ankle, around the knee, around the hip, around the back, in order to make sure that the body is moving correctly. Number 1. Number 2, it's not just doing strengthening exercises like we're doing a bicep curl, but there's a specific type of exercise called eccentric strengthening. Think of it as a negative, right? This is when, if I'll describe it with a biceps curl, if you have your, where am I in the camera here? If you're doing a biceps curl like this, that's called concentric. If you're taking this and then slowly bringing it down, that's called an eccentric strengthening exercise. And that's essentially elongating the fibers while you're contracting them. And that specific exercise has actually been shown to help with tendinopathy. And there's actually been research done specifically for the Achilles tendon in support of that kind of exercise. So that by itself should be the number 1 thing that's a part of the treatment program for somebody that has tendinopathy or that has continued issues after a surgery to fix that tendinopathy. That's number 1. The number two thing is what we talked about with shockwave therapy. The really cool thing about that is, again, if you think about that paintbrush that's matted and crusted, right? That shockwave therapy essentially helps with breaking down that matted and crusted paint that's on those bristles, right? It breaks down those sticky paint fibers and allows those bristles to be more free. And then if we do the eccentric strengthening with it, that'll help get those fibers moving more in sync and more parallel with each other, right? So that's number two. And then number three is actually using your biologics in a part of an injection-based treatment, using something called PRP. And we've talked about this before. PRP, platelet-rich plasma. The platelets are the things that stop the bleeding when you cut yourself, but they contain growth factors that can help with healing. And especially for a tendon situation like this, taking a needle and actually going through those tendon fibers essentially can help break down some of that scar tissue and matted paint in that paintbrush. And then the PRP can help with the healing of those fibers themselves. But again, practically worthless if we're not moving correctly. So really, I'm excited to put together these processes: the exercise, the rehab, the PRP type treatments, and the shockwave. I think having those in concert really can get us the best long-term benefits for a situation like this. But so tell me, in terms of the symptoms that you've had, I'm curious because I don't have an Achilles issue, right? You've had this surgery 8 years ago. What symptoms were you having up until the treatment yesterday?
Up until the treatment yesterday, it was a lot of tightness, especially in the insertional area. It just felt very ropey. The tendon itself, which is actually is essentially a medical term for chronic changes to the tendon itself. So I was also I had calf muscle. My calf muscles have definitely weakened in my left leg, and on the right they've strengthened a lot due to compensation. So I think those are the main changes that I've had. Yeah.
And then what did you notice? What part of that was different with the shockwave?
After the shockwave therapy, it just felt loose. Like I just felt like I could do more on my left leg. It just felt better. Like I felt like I didn't even realize that I had it until after the therapy. But I didn't even realize that I wasn't walking as well as I could be. I mean, that's huge, right? Because we're walking all day, we're standing on our feet all day, so it sounds like a simple thing, but I mean, that's a life-changing thing, really. Yeah. If you know.
How long did that last for? Are you still feeling the effects now, or is it gone now?
I haven't. It lasted for probably the rest of the day.
Okay.
I got it around noon. I believe it was around noon, and yeah, it lasted for the day. And Alan actually normally does 2 treatments together. He only did one on me with a medical school discount. But I think if you do the full therapy, I probably would be feeling better even now.
And just so I'm clear, Alan, how many sessions? What is it like for you to treat someone with Achilles issues?
He said I give him a half of the treatment, which is true. Usually. It's calculated into bars or impulses that you give. So for an Achilles, and what I do is I don't just work on the Achilles with the machine. If I'm working on the Achilles, I also like to go up on the calf, kind of loosen the whole musculature, the whole structure out, rather than just focus on one location. So usually we do about 2,000 pulses, okay, in 2 sessions. So I do 2,000 pulses, and then I get in there, I do a little bit of a modality, move the Achilles tendon around, do a little massage therapy on the calf.
Okay.
And then I go back, I do another 2,000 pulses on that.
And how long? 2,000 sounds like a lot.
I know it's a lot. It all depends on
how much of time frame are you looking at?
It's usually about 2.5 to 3 minutes for every 2,000 pulses.
Got it.
But it also depends how fast I want those pulses to hit.
Got it.
So the slower the pulses do, the frequency is low in between.
Depending on the tissue. It's going to take a little bit longer,
depending on the tissue and the location that we're working on. Exactly. So, but generally, we love to do consistent, about 5 to 7 treatments for us to be able to see very good results.
Got it.
Something that's really noticeable, something that The first treatment might last 1 day, second treatment might last 2 days, the third treatment a little bit longer, fourth
Right.
treatment, hey, I'm great, or fifth treatment. It kind of, depending on the body, how good it responds to it, everybody's a little different.
Sure.
So,
But that's an important concept, right? Because we're not doing something with this type of treatment, correct me if I'm wrong, we're not doing something that's just pain management here. We're actually trying to change some of the biology of the structure. This is kind of similar to when I do our orthobiologic treatments. We're not doing a cortisone injection that's going to zap away the pain and last for a couple months. We're looking for something that has long-term benefit, and we're dealing with something that's taken a long time to develop in the first place. So one treatment's not going to get rid of it like that. Although it might help temporarily, it's really the cumulative additive treatment over some time that gives us the best benefit. And correct me if I'm wrong, do you involve more than just the shockwave therapy? You mentioned the massage, but tell me a little bit more about the exercises. Do you prescribe exercises or anything along those lines?
I hand out some exercises for people for their relative injury, whatever that is they're coming for. I'm also a certified massage therapist, and I love working on muscles to know where the problems are, where the pressure points are, the trigger points are, for me to be able to release tension in the muscle. So, future tendinopathy, future Achilles, or any kind of a injuries, kind of like it's, the prevention, it drops down tremendously. And then, give out some exercises, stretching, either it's a lot of stretching, which I'm a very big fan of. I love stretching people. And also, also exercises. Exercise is always very, very important. When you break down the building blocks, you need to be able to strengthen those building blocks so you can build better foundation on it and move forward.
I think that's fantastic. And bringing it full circle to what you were talking about, Clay Thompson, the fact is that if we don't get the body moving correctly after we've had an injury, there's a chance that we're going to be walking abnormally, compensating, and then other issues are going to add on to the picture, right?
Yeah, of course.
So Clay had an ACL on the left.
Left or right, but then the Achilles was on the opposite side.
I'm imagining his picture. I think it was his left.
Yeah. So I mean, if we think about it, right? So what's interesting about ACL tears, complete tangent here, right? But ACL tears, once you have an ACL tear, you're going to develop arthritis there. If you have a surgery for the ACL tear, you're still going to develop arthritis there. What's interesting, though, is if you have an ACL tear on one side, it actually increases your odds of having an ACL tear on the other side. So if we think about that, why is that? It's because your mechanics are changed, right? So the appropriate rehab, the appropriate exercise, getting the body moving correctly ends up being so important. That's why even in situations with surgery, I think using orthobiologics to help augment the surgery makes a lot of sense, because sometimes surgery is absolutely necessary, right? Rocky's Achilles, we couldn't connect that with just injections, but doing that type of surgery, if we can go back in time, doing that type of surgery and putting some of the biologics there could have helped that heal more appropriately and get the body moving correctly, so that we're trying to prevent something going on with your other side. So doing something like shockwave therapy to keep that tissue moving properly, and then adding on the stretching, adding on the exercise, making sure we get the body moving correctly, so important, not just for the injury, but really for the whole picture overall.
I wish I had met Dr. Patel 6 years ago or 7 years ago, so I could have had this done. But hey, it's really an awesome thing. So.
But look, better late than never, right?
That's true.
The truth is that whenever we have an injury, I mean, there's some circumstances where, you trip down the stairs and you have an injury. Well, that was the cause of the injury, right? You tripping down the stairs. But oftentimes when we're going for a fadeaway and you land funky and that tendon ruptures, there may have been something going on even before that point that led up to that injury taking place. And I think that staying on top of it, being proactive, having that mindset to have the exercise, take care of the tissue with things like shockwave, take care of your body with things like exercise.
Always be stretching. Make sure you're always stretching. I didn't stretch enough. I was young, I was dumb, I thought, I don't need to stretch. You need to stretch. So, and he likes to stretch people, so that's good.
So I think it's really important takeaways here.
100%.
Yeah.
100%.
So
Sorry.
just wanted to say thank you to both of you for coming on this Facebook Live. They're my first guests on Facebook Live, so really happy to have them. Rocky, my med student, sharing his story. Thank you so much for sharing your story.
Thanks for having me. I appreciate this.
I think this is really valuable because to hear it firsthand from someone that's gone through it, both the injury, the surgery, and as well as the treatment. Actually, really interesting to hear how much he had some benefit from just half of a treatment, right?
Yes. And I do plan on getting some more shockwave therapy from Al. If he's okay with it, I definitely do want to do it some more. So
100%. 100%.
So I'm really excited. So Alan actually is not a part of our clinic, but he is going to be visiting in our office on a regular basis, and I'm really happy to have him as a part of kind of our team, our things that we can offer. If you do have a tendon injury or really any injury, feel free to reach out. If you have questions about your injuries, if you have questions about shockwave therapy, exercise, tendon injuries, any of that stuff, drop us a comment. You can DM or you can email us at info@fxregencenter.com. If you liked this video, if you enjoyed this or thought that this was informative,
give it a thumbs up.
Give it a share. And please spread the word. If you're interested in any other topics that you want us to talk about in the future, please, by all means, drop me a line. Otherwise, have a great rest of your Friday. Have a happy weekend and a happy Thanksgiving.
Thank you.
Thank you, Dr. Patel. Thank you, everyone.
Of course. Thanks. Thank you, guys.